everyone, I'm back, it's me again. This might be a bit of a boring video for some of you, but it has been requested, so here I am. When I was on holiday a few weeks ago, I was at a pub with like my friends. One of my friends was a nurse. We was just like chatting, having banter, like thinking about the good old days when we were nursing and all our stories and stuff like that. And the other people in the group were like, this is so interesting. And there was like, I never realised that that's what nursing actually was. Then there was like, oh, Crystal, like you should make a video chatting about your experience as a nurse, like what you had to do and this and that, and people might find it entertaining, so we shall see. I'm 25 now and I did nursing straight from college. So I went to college, I did health and social care. So I did that for 2 years, and then in the second year everyone was like, oh, we're all gonna go to uni, this is what we're gonna do. Like there was paramedics, midwives, you know, people that just wanted to work in care homes, that sort of thing, like social workers and stuff. And I literally did not have a clue, but I was watching One Born Every Minute on the telly and I thought, do you know what, that seems like that'd be like a really nice job. So anyway, I decided I'm gonna be a midwife. 5 universities, 3 of them said no straight off the bat, so that left me with 2. And basically to get into midwifery you have to do maths, well, and nursing, you have to do maths, English test, and do like a practical type exam. And I passed maths and English on both of them, and then I got into the next stage, and long story short, didn't get in, no space left at the inn. But then Norwich got back to me and they was like, oh, if you want to do nursing, we've got spaces on there for you if that's what you want to do. Oh, I thought, fuck's sake, but I literally had no other options, to be honest, at that stage. It was either go to university or don't. And I was thinking, if I don't go to uni, what am I gonna do? So basically I thought, fuck it, yeah, I'll just do the nursing then. Had absolutely no idea what adult nursing was, because obviously in my head I was thinking I'm gonna do midwifery. So I didn't even bother looking at like at nursing, because like why would I? Moved up to Norwich and I stayed in the shittest accommodation in the world. My toilet, you know when you go on an aeroplane and it's literally like a plastic like bathroom toilet and you can pretty much have a shit and wash your hands at the same time. That was my uni halls. It was on my very first day of nursing, bearing in mind I had no idea what I was going to be asked to do. I remember it so clearly because I was literally in shock. I had to give somebody a wash. I'd literally never seen anybody naked before, apart from like obviously young fit boys and myself. So that in itself was a bit of a shock to the system, shall I say. But anyway, I got on with that and that was fine. And then all of a sudden this really big alarm went off and everyone started running around and I was thinking, what the frick? What is going on? It turns out this guy, he was fine and he went to have his leg dressing done. The nurse like pulled the curtains round to do this guy's leg dressing, which is like putting plasters and bandages on someone's leg. And so anyway, she was in the middle of doing that and then she popped out to go to the clinic room to get some other bits and pieces that she needed. And then when she came back, he'd passed away like in his chair. And so that was like a massive emergency and everyone was there and everyone was getting involved and everyone was helping and all this stuff. Obviously me, it was my first day and I'd never seen anything like it before. I was just like standing back, just watching the chaos, well not chaos, organised chaos happening. So that happened, and then later on that evening, one of the elderly ladies that was on the ward at the time, she was end of life care and she passed away on that shift. So then I helped the other nurses to go through the procedure about what happens when somebody passes away, what we have to do and the paperwork and stuff like this. And that was also the first time I'd ever seen like a body of somebody. So that was my first day. That was just extremely unlucky, can I add, because not every shift is like that. Well, in my experience anyway. Yeah, that was my first day and I had to get the bus there and the bus back and go back on my own into this like shitty uni hall. And I had absolutely no money. I had no mates either. Well, I had like one. So yeah, that was my experience. But anyway, I got through it. I got my degree, and the day that I got my degree and I went to graduation, I swear down, that was one of my happiest days ever. Once I finished my degree, I thought, I'm just gonna have a break. I'm gonna have a break. All of my friends were getting jobs straight away out of uni, and I thought, Why? Why would you want to do that? I know we got no money, but like, just be free. I gave myself a break for how many months? And then I applied for a job working on a care of the elderly ward. In the beginning, it was just so much to take in and really, really scary, because all of a sudden you're responsible now, and you feel like you're expected to know so much because you've just done your degree, so you should be like fresh out the womb, you should be knowing everything. The average day as a nurse working in a hospital on a care of the elderly ward, for me, my personal experience was get there at 7 o'clock in the morning, and then you have a half an hour handover period, which is basically like a meeting. So the nurses that were on the night shift, they go through each patient one by one, tell you their name, you know, what their care needs are, whether they need help going to the toilet, all that stuff, and then basically go through like your jobs for the day. So then after we'd like finished doing the handover and stuff, and I know everyone's name and what I need to do for the day, then I get out the drugs trolley, would go around giving everyone their medicine, or try to, because remember I was working on care of the elderly, so most of these people have dementia. So that genuinely took me about an hour and a half to get through 6, 7, 8 patients. So that's quite time consuming. You know, working with elderly people, they tend to have about 50 billion different tablets. And they also like to refuse some of them, or drop them on the floor, or chuck them down their t-shirt, or where else might they? Just anything really, anything goes. And you can't give someone their pills and then walk off, because if some other person who has dementia comes wandering over, they might think they're smarties. It happens. And then the doctors come in at like 8 or 9, I can't actually remember anymore, but then they would come in, and then they go through every single patient one by one, all the ones they're looking after, and they decide what they want to do to make that person better. And then they would come to me and just tell me what their plans are. So yeah, then you start the jobs for the day. There's another drug round at 12. And in the meantime, everyone's asking different questions, asking to help out with this, do this, add additional jobs to the mix. And then somebody might get really poorly, and then you've got to like ditch everything else you're doing and go sort that out. So yeah, really, really busy, always on your toes, always prioritising jobs. And then at the end of your shift, the night staff come back in, and then you basically list all the things that you probably should have done in that day but just didn't have the time. So depending on where you work, you can do like additional training, and you can be taught how to use like fancy different tools and whatnot. For care of the elderly, usually they just sort of focus on like dementia care and stuff, which actually, like, it sounds really boring, but it's so interesting. Well, I think it's so interesting anyway. But when you try and understand it, when you try and wrap your head around it, it's just baffling. I've experienced it before, where I was looking after this guy, and he had quite advanced dementia, and he was just sat in his chair, and he was going, he was talking something to do with the army, and he was asking me about planes or something, and I just sort of questioned him. I was like, oh, what was that? And he said, oh, we're in an army camp right now, aren't we? And I said, no. And then he was like, oh, what do you mean? There's a plane over there, there's this over there, there's all the tents there, and these are all the soldiers. But just how he could be sitting in a plastic chair in a hospital ward with hospital things, with nurses, with a bunch of people wearing pyjamas, and somehow his mind has created this like illusion of some sort. I don't even know. And another thing that happens quite a lot, which is really bizarre, is I experience quite a lot of people saying to me that they can see chickens. Like, I know that sounds crazy, but genuinely like 10 different people. So I don't know whether the hospital was like built on a farmland and those chickens are like ghost chickens that I can't see, but they would be eating their food, and then they'd literally giggle and smile and like point at nothing. And then I'd say, what is it? What can you see? And then they'd be like, oh, little chicken. And I'm thinking, how? But these people wouldn't be seeing the same chicken at the same time, because otherwise that's 100% ghost chicken. But it would just be like, one lady would say, oh, I can see a chicken. And then I'd go into a different room on a different day, and then some guy would be like, oh, can you get these chickens out my room? And I'm thinking, what? Zombie chicken invasion? What the heck? This is creepy. And I also, this is one memory that I do also have as well. We was looking after this man and he was so sweet, and he had dementia as well, but he used to be used to work on the trains and do something to do with the tickets. So he was so unsettled and he was like wandering around, getting really aggressive and really angry with everyone because he was just getting so frustrated about the whole situation. Because in a hospital, you can't just get up and wander around. People have like IV drips hanging up with their medicine going into them, and if somebody with dementia was to go over there and like pull it out or fiddle with something, like it could be really dangerous. So that's why it's so important to like keep them safe. It's so tricky because sitting in a chair all day is so boring. I'm not surprised that people in the hospital end up getting really pissed off, because if I was told I need to sit in a chair all day and I'm not allowed to get up or do anything, I would go insane. I would be so frustrated. But then on the flip side, if anything happens to somebody else, like that, that is just worst case scenario. That just can't happen. We take it in turns to like keep an eye on somebody, but sometimes it's so busy you literally just can't. Like if you have somebody that's wandering around the ward fiddling with different things, but then if somebody else really needs help or there's an emergency or somebody fell over, you have to just like prioritize that and leave that person. So it's always, this is like constantly going on throughout the whole shift, which is like just really stressful. It is actually fully so stressful because you feel so responsible as well. Oh yeah, so the ticket inspector man. I had a marvellous idea. We were sitting on a chair. I was sitting with him just to keep him company for a little bit, and I got a wedge of tissues and I put the tissues on the bed and I said to him, should we fold these up together? Because I know that sounds really drab and boring to anyone else, but if you've got nothing to do and somebody asks you or gives you a role and asks you to do something, then that just like, it tends to keep people quite happy. And I thought, I've got 10 minutes. So anyway, I got these tissues. I didn't know if it was going to work or not, but I started folding and he was going, oh, well, these all the tickets, are they? And I went, yeah, they're all the tickets. You gonna help me fold them? And he was like, yep. Folding all the tickets into squares, and then he'd like move them over, do this, shuffle them, like literally with a wedge of tissues, just going like this, and then like speaking to me about things I couldn't really understand because it wasn't really making much sense. But yeah, that was just like a memory that I've got. I thought, I did that. That was my idea. And he really liked it. And it was nice just to have something that he could do. It's safe. No one's getting injured. He's calm. because also it would get really fucking annoying if everything that came out your mouth, somebody was telling you you're wrong all the time. Do you know how annoying that is? Yeah, sometimes it's good just to go with the flow. Like there's loads of different people have different opinions on these things, or whether you should or whether you shouldn't. For the most part, if somebody says to me, where am I? Of course I'm not going to be like, oh, we're in Fantasyland, way. Of course I would be like, oh, you're at the hospital, I'm so and so, this, that, the other. The wages. How much money did I get paid as a nurse? So full-time is 3 shifts a week for 3 weeks, and then on the 4th week, 4 shifts. Part-time is just 3 shifts a week, so it's only 1 shift less counts as part-time. And basically, I realised that there's no point doing full-time because I don't want to do 4 shifts a week. My take-home money that went in my pocket after a month was 1,300 Great British pounds. That was as a newly qualified. It'll go up a little bit as the years go on and whatnot. You can do like extra. If you work on a Saturday or a Sunday, you get a little bit extra. And if you do night shifts, you get a little bit extra as well. That's like just an average, how much I sort of roughly get. Yeah, I mean, if you did your normal job and then you picked up extra shifts on the side, probably you could get like £1,700, maybe, something like that. These are some of my worst experiences / stories of nursing throughout my little career. So number 1, coming in hot. This was possibly the worst thing I've ever experienced in my life to this day. So basically, I was working in the community. It actually makes me feel a bit sick now. I was working in the community and we went to this guy's house because he had like this long-term catheter. So if you don't know what catheter is, it's basically a straw that goes in your penis. And if you can't like wee properly, it's just like a tube and then it goes into this bag. So you basically have to like walk around with a pee bag. Anyway, he had one of those and it was like a long-term one. So you only change it like once every so often, but it stays in for like quite a while. And I was a student at the time. So the nurse I was working with was like, oh, Crystal, like, do you want to take this one out? And I thought, yeah, I'll get stuck in. Anyway, so I did everything properly. She was talking me through it as we went along. She was really, really good and explaining everything to me, and I did it. And as I like just pulled out the end of the penis, a piece of dick jelly, a piece of dick jelly from the inside of this old man's penis flicked on my lip and in my face. And I'm not even joking. It was horrible. It came out and it wasn't even my fault. I didn't do anything wrong. It wasn't like I yanked it out or anything like that. It's just that these things are like a really bendy, like rubbery tube, and just as I took it, it was literally just the end of the thing just went, and the jelly went, and it went in my face. Okay, that's so exaggerating. It flicked in my face and went on me, and obviously you can't be like, ah! But that's what I wanted to do. I literally just was like, wipe it off my face, carry on, be professional, like, oh, you okay, it's all done now, blah, blah, blah. And then she went on and done like the second bit and put like the new catheter in, whatever. And I wanted to get bleach and like bleach my skin off my face, because that was like residue that had been accumulating for months, and it was on my lip, like here at the top of my lip. If that went in my mouth, I don't know what I would have done. I would have quit nursing forever, I think. So that was up there with #1 worst experiences of my life. What's something like we have to do like a bunch of yucky stuff? Yeah, sometimes you have to put your finger in personal orifices. Yeah, that's not one of my favourite things to do, but needs to happen, necessary. So anything else that's happened? I've got so many stories, but I feel like I'm gonna get slated in the comments for like explaining some of these things, so I've just got to be very careful what I decide to share. I was only nursing for a little while, but on one of my shifts I did actually experience cardiac arrest, and it was on the patient that I was looking after, and that was like the biggest rush of adrenaline I have ever felt in my life. So I was looking after this patient, and I went in there, and the patient said to me, oh, I feel a little bit sick. And I was like, this is first thing in the morning, and I was coming around with the drugs like shortly. So I said to her, okay, I did a blood pressure and everything like that. It was all okay. And then I went to the drug room to get her anti-sickness tablet. So I went to the drug room, got that all sorted. Someone else had to like double check, make sure it was the right pill and all things like that. I had it in my hand, and then one of the healthcare assistants said to me, oh, Crystal, I really, really need your help. We're having a nightmare in here. We're having a code brown. There's brown everywhere, and I just need another pair of hands. And I thought, okay then. So I put that down, came in, helped her clean this person up and whatever, get him all sorted, and then I came out and then got the anti-sickness and went to take it to this lady who was feeling poorly. Went into the room, she was in her chair and she'd passed away, and I literally chucked the tray down on the side, and everyone's got this folder that says whether they're for resus or not, whether they want to be resuscitated if they had a cardiac arrest. So anyway, open that thing, there was no do not resuscitate form, so that means you have to do your compressions and everything. It's a full-blown emergency. Everyone needs to come there. So I got supersonic strength, and I pulled the emergency alarm, the one that goes, whew, 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 and everyone comes running, and I literally managed to lift this woman off of her chair onto the bed, started doing the compression. I was in full-blown panic mode. I was thinking, oh my goodness, what did I miss? Doing the compressions, and then they bring the drug trolley and everyone comes in. There's loads and loads of doctors there. Everyone's doing their bit. Everyone knows exactly what to do, and it was really, really good. One person's in charge and they're telling everyone, and then we're all doing the absolute very best that we can for this person. And then the advanced doctors come in, and they know all this like fancy stuff where they can get like big needles into people and give them like this, you know, medication to try and help them like to restart their heart and all stuff like that. So they came in. There is actually a procedure you can do in an emergency where you drill into somebody's bone to try and get an IV access so you can give the medication straight into their bloodstream and try and, you know, get it working basically. So that happened, and you have to put these breathing tubes, just literally put a breathing tube down the throat to open up the airway. We tried for 45 minutes, I think. It felt like 5 minutes, but we were going for about 45 minutes, and it got to the point where take a step back and like assess the situation, and it, unfortunately, there was nothing. We tried everything and there wasn't anything else that anyone could do. But I'm telling you now, everyone was so good. Like, I felt like a really valuable member of the team in that situation because I was kind of like, I know what we're doing here. We're doing this so well. And so anyway, that was like a huge adrenaline rush. I just walked out of that situation and I was really shaken up and I was just so upset and I just felt so guilty and like all of these things. I was looking after that lady and I felt responsible for her. I walked out of the room and this patient's relative came over to me and said, "My granddad hasn't had his teeth brushed today." And I said, "Okay, has he got a toothbrush?" And she said, "Yes." And I said, "Would you like some toothpaste?" She went, "No, I ain't doing it. One of you need to do it. I'm not brushing my granddad. That is basics. You should be brushing everyone's teeth in the morning. I want to know why no one's brushed his teeth." You know when you just think, why don't you fuck off? Just fuck off. That woman had no idea. And I couldn't say it. I couldn't say, "Oh, actually, we've just had a real emergency in that room and sadly somebody's passed away. So if you wouldn't mind just brushing your own granddad's teeth for one day." So I ended up brushing this man's teeth. I know that that's one of his care needs and he should have his teeth brushed every morning, but sometimes there's other things that are more of a priority. You know? I should have got that toothbrush and shoved it up her ass. And her attitude was just fucking horrendous, so she could just piss off. I did do it though. Really, really sad. That was one of my worst days. It's still ingrained in my memory now. I can still remember it like it was yesterday. We always do this like debrief. So the whole team sit round together and we talk through everything that happened. You know, if you've got any feelings about it and stuff. And I found that so useful to be able to just get it off my chest and just explain how I feel. I just almost needed somebody to tell me that it wasn't my fault. It actually wasn't my fault. I won't go into the details about like what happened, but it basically wasn't anyone's fault. It was just this thing that happened. It was very quick, and that was a huge sigh of relief for me. Jeez, that's one of my stories. I hope you found that a little bit interesting, maybe learnt something, put it on whilst you do your makeup or whatnot. I don't know what you guys want to do with that, but don't forget, press like, subscribe. See you soon.